I'm Chandan Devirreddy, Associate Professor of Medicine at Emory University and interventional cardiologist. Hypertension or high blood pressure is an elevation of that blood pressure beyond a healthy level. Hypertension is not necessarily something that patients can feel or be aware of and is often described as a silent medical condition. But what is not commonly realized is that the most common underlying condition that may lead to heart attack and stroke is high blood pressure or hypertension. There are many different medications amongst different classes of medications which can be very effective at lowering blood pressure. The problem that has been shown in studies is that patients who are resistant to our standard hypertensive solutions are at higher risk for these cardiovascular morbidity and mortality events that may plague them later in life. There is a specific control system termed the baroreflex receptor, which is located just around the carotid arteries, which are the arteries supplying blood to the brain and the neck. These areas are what I often term the patients as our blood pressure thermostat. The baroreflex system and the carotid baroreceptors are constantly monitoring the amount of stretch or pulsation in the arteries. And if the pulsation is felt to be too high, then the brain gets signals from the carotid receptors and the baroreceptors to try to lower the blood pressure. The MobiusHD device is an investigational device that is delivered through a catheter-based system, a minimally invasive procedure, to implant this inside the carotid artery to stimulate the carotid baroreceptors to increase the amount of nerve traffic to the brain with the potential to lower blood pressure. The term for this procedure has been described as endovascular baroreceptor amplification, or EVBA. So the CALM-2 trial is a multi-center randomized trial for patients who have treatment-resistant hypertension. It's a study of the investigational MobiusHD device for its safety and its potential efficacy in lowering blood pressure. For these patients, if we could effect some durable method of lowering blood pressure over the long term, the question is, could we possibly lower overall morbidity in the form of reduced rates of stroke, heart attack, kidney disease, and the need for dialysis if blood pressure can be more effectively lowered in the overall population of hypertensive patients? Studies like CALM-2 are just one small step in answering some of these questions, but our hope is along this journey and pathway of studying treatment-resistant hypertension and methods of lowering blood pressure for these patients, we may in the long term discover or realize ways to effectively lower blood pressure and reduce their overall morbidity.